afternoon to you all. My name is Celia Gracelin. I would like to present before you the prevention and care of eczema. So, first I have to say that it is one of the most common skin diseases that we can see in adults and children. To start with, this eczema is an inflammatory skin condition which comes within the body, but when we hear the name, it is most similar to one other skin disease called dermatitis. But the only one difference between dermatitis and eczema is dermatitis is coming from outside the body, but eczema is coming within the body. And one of the most important thing that I have to remind you is the eczema is not contagious, so you don't need to worry if somebody have if somebody have eczema nearby you, so it is not communicable. And we can see it affects the skin protective barrier mostly, and it is associated with various diseases like asthma, hay fever, and mostly it is hereditary in nature. The second thing I have to tell you is they can appear as very itchy patches, and it will be red, swollen and cracked from scratching, and the rashes usually appear on face, in the elbows, inside the elbows, behind the knees, and in hands and feet. So when talking about the causes, really it is unknown. We don't know what is the real cause for eczema, but there are some evidences like it is really linked to genetics and various environmental factors. Next we will deal with the aggravating factors in hand eczema. So usually we will see eczema in hands and feet. So first we will see about the hand eczema. There are some reasons to get the hand eczema. So first one is frequent wetting and drying of hands. So if we are washing our hands every time, there is a chance to get hand eczema, because some people will be so irritable with the soap and all those things. So we can see our skin will be more dry, and if we don't use any, usually don't use any moisturizers. So here, some soaps, detergents and shampoos, some household cleaning products, paper towels, then solvents, cements, oils and grease. Then some people have sweating in hands, and if they use some gloves, it can cause this hand eczema. And the second one, the last but not the least, this is excessive heat and stress can flare up this disease, and the severe fungal infection of the feet. So these are various things that we have to see about the hands eczema. And the next one is how we can manage the hand eczema. So do you have any idea how we can manage some hand eczema?
Good skin care.
Yeah, you're right.
Hand hygiene.
Yeah, that's right. So we have to give a very good skin hygiene, skin care to get rid of this eczema. So and the most important part, the crucial part to get rid of the infections and mostly to be away from all of the diseases like hand washing is very important. Okay, but in this case, eczema, those people who are very irritant to some soaps or those kinds of things, we have to have a good skin care. The first one is moisturizing cream. We have to use it regularly. And then other than soap, we have to use some soap substitutes. And then we have to limit our wet work, like we have, limit working with water, we have to limit it. And then, we have to use cool water, but not use warm water, because it can increase the hand eczema. Then wear appropriate gloves, that means cotton gloves. So if we are putting some other type of gloves, it can make the hands sweaty, and thereby it can lead to some hand eczema. So we have to avoid those things. Then next one, I am going to the treatment and intervention, which is exactly my topic. intervention of the eczema. So first one is avoid irritants and allergens. We have to avoid irritants and allergens because these are one of the main causes that is affecting the eczema. So we have to remember to wear protective clothing like gloves, whichever is useful for them, like avoiding the gloves which is so irritating to the skin. And the second one is washing immediately after contact with irritants. We have to wash our hands. It doesn't mean that we don't have to wash our hands if we get eczema, but the thing is we have to wash, but we have to take care of the skin by using moisturizing agents and all. And the next one, wear protective clothing and wash immediately after contact with some irritants. Avoid common environmental irritants like pollens, house dust mites, and all those things, animal dander. So these all are the environmental irritants that might cause eczema. Then avoid excessive heat. Heat is another important thing that might cause this thing to increase the eczematic conditions. So better to avoid heat. That means warm or cold is okay, but more heat atmospheres you have to avoid it. So that means bath in warm water. It is better than rather than hot. And we can use air conditioning and fans too, and that will help in summer. So remember to use air conditioning or fans in summer. Then in the winter, turn down the heater. So that might also cause the eczema. Don't use the electric blanket, the air conditioning and fans, that helps in summer. And the next one is use soap substitutes. That's a very important thing, that when we take care of eczema, soap and detergent is alkaline. When I say about the soap and detergent is alkaline, I want to say that these things are more alkaline in nature, so it makes so dry. And soap and shampoo substitutes to be used. Bath oils can be very helpful in preventing or managing this eczema. And we can spray oil to the wet skin, yeah, and simply dry it, but don't do it roughly like that. And we have to take baths for a shorter period, less frequent, so it can help treat the dry skin. Okay. Next one is moisturizers and emollients. So these moisturizers are really important to get as good skin care, to avoid very dry skin. It will prevent itching, scratching and all those things. Usually this itching and scratching, all those things come from drying, right? Yeah, yes. So we have to avoid it. And the regular moisturizing of our skin is very much needed every day, and we have to practice it as a daily routine to avoid dry skin, thereby leading to eczema. So it doesn't happen to everybody, remember, but in some clients that might be, in some people that might be a reason to get eczema. So, but we have to take care while selecting the moisturizing lotions because there should not be any perfumes or preservatives in that. That might irritate the skin. Moisturizers should be applied frequently, at least twice daily. So, if we are using moisturizers early in the, we can use in morning or evening, just after taking bath or just after coming after the bath. Okay. And we have to apply ointments too, which is most effective than creams or lotions for very dry skin. And the best time is to apply the moisture or emollient, as I already told you. That means whenever we are coming just after the bath, that's the right time to put on the moisture. Okay. And another thing is wet dressings. The wet dressings, when I say about the wet dressings, apply emollients or steroid cream to the skin. Then, okay, we have to apply wet dressings like we have to apply the emollients over the emollients on the skin, and then if we are soaking the dressing with warm water and then put it on above the skin, and that might help the eczema. And we have to leave it for 15 minutes to 1 hour at least, and it should be applied 3 to 4 times a day. Okay. Next one is about steroids. There are various kinds of things, creams and ointments with corticosteroids, and these things will decrease the inflammation mostly, and we can safe if used correctly. We have to use it in the right way to act very nicely. And then there are some topical immunomodulators are there, that is prime prolimus cream that can control inflammation, and it cannot be used for prolonged use, okay? And it's not safe to use prolonged. Next one is about antibiotics and antiseptics. So if a person have eczema, that can lead to scratching and itching and thereby infection going into the skin, right? So we have to have some antibiotics.
Yes.
Antibiotics and antiseptics both. So as eczema is very susceptible to infection. And the next thing is antipruritic preparations we can give for the eczema patients, like sedatives, antihistamines, and oatmeal bath and bath additive and pine tar preparations. All those things help the eczema. Then some kind of nutritional supplements are also there that can help the eczema. Primrose oil, fish oil, borage oil, and treatment for, there are some treatment for severe eczema too. We can use some suppressants like cyclosporin when all other fail, okay? And treatment for the severe eczema will be, we can use suppressants. Suppressants is cyclosporin, and if all other things are failing, we can use phototherapy by ultraviolet rays, okay? So there is a diet. This is the diet that we can choose for eczema patients. Glycine, that is an amino acid. It is for the safe elimination of salicylates. This one, salicylates, can you, do you know what do you mean by, no. Can you say one of the salicylates available? Aspirin.
Oh, okay.
Okay?
Aspirin.
Yeah. So that is one of the salicylates. So if you are using this one, then it is for the safe elimination. And second one is probiotics. They are so friendly. It serves as the bowels with the bacteria that promotes healthy bowels. Okay. So for example is acidophilus. The third one is chlorophyll or apple cider vinegar and have alkalizing effect. The biotin, it's a vitamin B, and it is really important to be consumed for the rash-free skin. And the next one is moisturizing food, such as water. 8 to 10 glasses per day we have to drink it. So, and then the next one is omega-3 fatty acid, like cold water fish like sardines, salmon, and green leafy vegetables, we have to eat it. Then avoid artificial colors, preservatives, and sweeteners. So these are the very important things that we have to remember in our mind to be taken care of the eczema. So the main thing is for eczema, we have to eat healthily for a healthy you and stay eczema free. So that's all about my topic. So do you have any concerns or any questions? Please don't hesitate to ask.
Cold weather is good for these people's head?
Yeah, it's really good. Cool weather, cool water. So avoid the hot things, but you can use the warm.
Warm water,
Yeah.
not really too.
Okay. So people in Canada will be safe.
Yeah, I guess, because they don't have much hotter environments or weather, so that's great.
Thank you.
Okay, thanks then.